Our first series welcomes topic experts using the ISPA 8 investments to frame the conversation, showcasing Scotland's whole systems approach through a long-term health condition lens.
Hello, everyone, and thank you for joining us today on the Movement for Health podcast, Movement in Conversations. Today, we're talking about Scotland's active places and spaces, and I'm joined by two experts in many fields, Dr. Callum, Leese and Irene, Beautyman. Hello to you both.
Hello.
Hello. So Dr. Callum Leese is a general practitioner up in Aberfeldy, and Irene Beautyman is the Programme Lead, Place and Wellbeing Partnerships with Improvement Services, and a dual role with Public Health Scotland. Is that right? Excellent. And Callum, you have many hats. You are very involved in another podcast, the Movement Prescription Podcasts. So Callum is a natural at all things podcasts. Just prepping you, bigging you up there, Callum.
Pressure.
And today, though, your hat is firmly on for Aberfeldy's Scotland's Healthiest Town project. So we wanted you both on to help us get a national and local picture for Scotland, looking at specifically active places and spaces. Irene, would you maybe kick us off, if that's all right, talking about your work specifically in this field and the place-based approach?
Yeah, certainly. So a place-based approach, there's a lot of confusion really, even when we talk about active places and when we use that term place about what we mean, frequently thinking it's a very local thing if we're talking about a place, where a place-based approach can be taken across the whole of Scotland if you want it. There's no geography that you have to keep to. But what you do need to do is you need to be considering what's happening to the people in an area. In this particular instance, how are they faring? How's their well-being? But that covers more than just health stats. That's poverty and issues like that. And to do that, stats alone don't work. That needs sense checked with people themselves, and particularly with those experiencing inequalities who are less confident to come forward and take part in having that kind of voice within life as well. So that's a crucial element. But another element that you need to have is you need to know about all the factors that you want to get right in a place. We know that the places where we live, work and play have an impact on our well-being and enable us to thrive, or can have quite the opposite impact upon us. So we need to know all of those features. And in the work that I've been doing for the past 3-4 years, we've focused that on a set of place and well-being outcomes that identifies all the things we need to get right in an area. They're based on evidence that Public Health Scotland pulled together. A full review of all the evidence that shows us if you do this intervention, this will have a positive impact on the people that use that place. So those are the sort of two elements of we need to know what's happening to people, we need to know what we need from a place, and then the third bit that is crucial to a place-based approach is how do we bring that into decision-making processes then, so that all the different stakeholders in an area, such as Aberfeldy, if we're talking about that everybody that's got an impact on Aberfeldy is thinking about their impact on those experiencing inequality and the aspects that we need to get right in a place to make sure they're not, without intending to, exacerbating what's happening to our communities and making it worse because they're just focusing on perhaps one area. So that's been the work that we've been in, working with 7 towns across Scotland and capturing the learning. And we now have a website with a full resource so that others can take that place-based approach.
Excellent. And is that our place?
It's the Shaping Places for Wellbeing programme that all sits on the Improvement Services pages.
Excellent. Thank you. And how can this be used retrospectively? So I was instantly thinking about that's excellent for planning new things and new things in places. What's the process for people looking retrospectively at something and using this toolkit and the resources?
Any of the plans and strategies and proposals that cover a place, if they are considering their impact on that place, then that happens. It isn't just about new development. We've got change in our environment all the time, not just, new housing on the edge of town or something like that, but our environments are constantly changing. We're regenerating them. That's the work of many of our councils, is to be looking at that regeneration of our our town centres in particular at the moment, where you're definitely not talking about as much it being new, but what is that new role for our existing town centres post-COVID? Everybody's online, and we know that, town centres were struggling prior to what was happening with COVID. So even in that, using that as an example, there's work being undertaken by Scottish Towns Partnership in partnership with Scottish Futures Trust, and I think Architecture and Design Scotland, looking at there is a new role for our town centres, and it's about people coming back to live in our town centres more. So as I say, our environments are always changing, and something as basic for us as our town and village centres are changing at the moment because of what has happened with us all being more online. Change goes on, and it's applying a place-based approach to all of that change as it's happening as well.
Excellent. It's wonderful to think about people being very involved with this process and being able to have a voice, as you say, and to be able to help shape for what their individual needs are. Do you have any examples of what that process is for a local person, for example, to be a part of this change and place-based approach?
Yeah, so for ourselves in the Shaping Places for Wellbeing programme, what we did in order to reach out and get insight from the particular population groups that were experiencing inequality in the areas that we were in and working in, evidence and research already told us it's difficult to make contact with the individuals for them to have the confidence and desire to want to come forward. So we worked firsthand with the community groups, the third sector, frontline workers that were working with those experiencing the most inequalities, and we captured their insights. So almost not the direct lived experience of one or two people, but the lived experience of those working day in and day out with those experiencing inequality. Not just to sense check what the factual data was telling us about what was happening to people, but to ask them what did they need from their place, what were their thoughts on their place, and to be able to capture that. And to be able to do that once for an area rather than through many, many different consultations that we tend to go out with on this plan and that proposal, but to do that once, it can then give that voice to those experiencing inequality to take into many, many, many decisions as it's all pulled together into one document. But another aspect, I would say, of having that voice, if you're an individual, is to be part of one of those different third sector groups that are springing up constantly in our areas in a response to a need and an ask from the community, and to be part of that. But I do highlight again that many of those third sector groups are well able to take part in society, and we have to make sure that we are going directly and finding out from those that are less able to take part in society. We can't reduce inequality if we're always listening to those who are actually faring very well in society and are very vocal. We need to make sure that as any third sector group that we're part of, that we're considering those that are not faring so well and thinking about the impact of our decisions on them.
Absolutely. It's excellent to hear that richness of thought that can go into these discussions, and how do we reach the people that need it most. And that's something with Movement for Health. A lot of the people that we are hoping to support through this work may be living with really chronic conditions and really don't feel able to be included necessarily with many of the decisions that are made for them, not by them. So that's really great to hear that thought is absolutely pivotal and centre to this programme of work. Callum, from an Aberfeldy perspective and the very ambitious title of Scotland's healthiest town.
Aspiring to be.
Aspiring, an ambition,
yeah.
an ambition. It would be wonderful if that ambition was everywhere. I love that ambition. At a local level and through a local lens and through a general practitioner's point of view as well, if you could tell us a little bit about the project of becoming Scotland's healthiest town, potentially. And I'd really like to know about those in your community that have had a voice in how this programme works and how it's designed and how it evolves, and how it listens to people in the community that, like Irene was just describing, potentially haven't had that voice before. If you could tell us a little bit about Aberfeldy maybe and set the scene first. aim, and then we could dig a little deeper.
Yeah, Aberfeldy is for those that don't know, is a town in Highland Perthshire. It's just under 3,000 people. The practice area covers about 6,000, so it covers Kinlochrannoch and kind of up to Rannochmore as well. I've been working in the town for over 4 years now, and when I first moved was during COVID. I was struck by two things in COVID. One was that in general, people's health were getting worse. I think we can all name the exceptions that with the free time started doing Ironman and all the other things. And that in general, people's health were getting worse. And I think what shocked me most was a lot of people didn't have the skill set with which to make the changes to their deteriorating health. And it seemed kind of quite a big disconnect there. And so a group of health professionals, and I take very little credit for what's happening or happened and happening. I think it's very much a team effort of which I at times have just been cheering from the sidelines. But four of us started meeting and asking questions about how we could address this in Aberfeldy. Inspired by the Blue Zones, Dan Buettner has written a wonderful book, and there's now a Netflix series. We kind of wanted to see how we could make kind of positive change and positive messaging. And I think that evolved over time. I think initially our thoughts were a kind of slightly tongue-in-cheek movement to try and inspire change from as opposed to kind of a more of a stick approach, which I didn't want to take. And for about 18 months, it was just conversations with lots of their local organizations. I think, Irene, you made a really important point of just engaging with the community. And I actually, that was a really amazing 18 months because it gave a real insight into the depth of experience in Aberfeldy. The amount that's going on was beyond my kind of wildest imagination. And I keep being surprised by things that are happening. I know that there's various things out there, like a lot, what Alice is called, isn't it, Emma? That is kind of community mapping, but there's just so much going on that we haven't or aren't able to map. And if you are looking at doing anything, please, before you do, just check it's not happening already, because it might just be that you can use your energy to kind of push something forward that's already established. And then I suppose you're kind of the gap that I've not addressed is possibly what do we see ourselves as? I think that's evolved over time. I think we're all busy. We're all health professionals, and I think we see ourselves as a tool for a change. So we're here to support people, and so we have a bit of a team now. We've got a project manager and some other brilliant workers, but our hope is just to support locals that want to make a change, as opposed to make the change ourselves, because we're aware that our time is really limited. So I think inequalities is such a challenging thing, and Irene, I'm so glad you brought it up. For those that are interested, there's a really amazing Health Foundation report from 2020, which talks a lot about behavior change and the challenge of agency. And I think for agencies, a kind of an inside term that I've got to know a bit more about, but it's basically knowledge, skills, time to make the change in your lives that will benefit you. An agency is a thing that people in higher social economic classes have more of. And behavior change policies like smoking cessation or physical activity promotion are based on agency. And so actually, by delivering those policies, you do risk widening inequalities. Report, really interestingly, I'm not doing it justice, it's worth a read, but it says that at some point, politicians have to become unpopular and make hard decisions. And whether that is pedestrianising high streets, or people will be unhappy, but it's a really important part of addressing inequalities, and cites the 2019 ban on sugar and fizzy drinks, which was controversial, but actually the outcomes are amazing. I can't quite remember. I don't know if either of you two are able to comment, but it's something like 30% drop in dental extractions in under 11s. It's something really impressive. Going back to Aberfeldy, so it's really easy to reach the people that you don't need to reach, or that necessarily don't need your help, particularly with an idea like this, which is or intending to. And so think we've made a conscious effort of trying to engage with places that maybe people of that need the help attend or engage. And so one of those places is definitely the health centre, and using the health centre as a means of engagement and referral. And so we have a kind of physical activity lit worker that now works in the practice to help engage people become more active. There's more we could do, and I acknowledge that. And I do worry about how we address it better and do more. Any ideas are welcome.
Thank you, Callum. I was just really struck by the intention being one that was led by healthcare professionals in the area. I thought that was a really interesting model to consider. And I was nosing on the website and found your link worker, who's obviously a pivotal sort of cog within actually supporting individuals to become more active or make different choices. A harder question maybe is, how might someone or healthcare professionals working in, say, deep end practices in urban Glasgow or Edinburgh or any of our cities and towns, with facing really different maybe sets of circumstances with patients and those chronic conditions that they may be living with, how could we look at the place-based approaches and the blue zone modelling, for example, within those types of areas, and how could people benefit, and how can people working in those deep end areas take some of these nuggets that we know work, but in practicalities might be very more challenging?
Yeah, I think it's a great question. I think there's probably three things I would mention. The first is the role of the health professional. I think there's a role of advocacy as a health professional, and I think I know the research is fairly unequivocal that the more active the health professional, the more active the patient. I.e., if you feel the benefits and live that out as a health professional, you're much more likely to recommend it to patients. So what might that look like for any health professional? I think for me, it looks like making the most of the kind of easy wins or the low hanging fruit. So maybe have a standing desk in your room, have a bike helmet on your table, and your trainers in the corner. Just have those visible signs. Prioritize it as something in the health center. So maybe it's having a workout area in the waiting room, or just a static bike there that people look at and say, oh, wow, okay, they prioritize this here. I think meeting people where they're at is really important. I was very lucky to spend some time with WHO Europe in Copenhagen. We did some work around urban green spaces. And one of the things that really surprised me is how little value outdoor gyms have. I thought they were a great idea, but actually the evidence shows that people that use outdoor gyms are people that would have exercised anyway. And so we need to be careful how we invest. That basically the gateway to getting people more active is nice walking routes through green space. So I think it has two benefits. I think we talk about the benefit of physical activity, but I think we can create spaces and places which are greener and have more green space, and that also offers uplift. And so that's another thing to consider. So I think design and planning in the environment, there's a role that health professionals again can have in that, whether it's using the real estate that you have to put trees or planters with lots of flowers that can. But also advocating for joining forces. I've really not seen much of it. Well, I've seen more of it and would like to be involved myself, joining forces with people like Irene and saying, look, we need this for our health, and lending our voice, because I think we represent our communities, or can represent our communities. And then finally, I think there's some amazing organizations out there that really aim to engage people in kind of innovative ways. Have you come across Man v Fat at all before?
No, tell us more about.
So Man v Fat's a really interesting organization. It's based in Colchester, and basically was set up by a football fan, and he basically wanted to engage fellow middle-aged men who watch football and might not otherwise engage. And so what it is it's basically five-a-side football leagues that are in different towns set up through football clubs. You turn up with your 4 colleagues in your team and you have a weigh-in, and for every pound you lose, you gain a goal on the pitch. So if one team loses £10 and the other loses 5, the game starts at 10-5, and then the goals add on top of that. So it's a really interesting way of kind of engaging people in their interests.
I think gamification is a really interesting concept, and nudge theory and things like that can help with individuals' behavior change. Absolutely. Irene, from a planning national approach, talking about those inner city urban areas that I'm thinking of, the deep end practices that we work with, what have you seen, or with the 7 places that you have directly worked with, any examples of some changes that can make those experiences more manageable for individuals' behavior change?
For individuals, I'll come on to that in a minute. The biggest difference that GP practices across all of Scotland could make to what we're doing is to share their data, which doesn't happen at the moment. So there's a vast amount of data that we gathered. It was all secondary data. It's all about people being admitted to hospital and, consultants' appointments. But that primary, what is called primary data about why people are going to their GPs, how many are going with mental health issues, what's their age group, you could imagine being able to build much more of a profile about a town that tells you the real issue here is mental health, and it's women in their late 20s that's happening to. But we can't do that because we do not have that access to that primary data. That happens in the odd parts of Scotland where a few GP practices come together and agree to share it. But other than that, there's a massive gap in the data that we've got about people. So if there's one thing that could be done, it would be that. So Callum, if you can sort that, I'd be delighted.
That's a total.
When we talk about individuals and impact, again, whilst having organised sporting things for people to go along to and to encourage them to be active, what we have found is that the biggest impact is that people step out their front door. First of all, that they want to step out their front door. They're encouraged to do that by the environment that's out there. And then when they step out that front door, they are able to get to the resources, the work, the education, all of the different things that allow them to take part in social life, economic life, and just life in general. That the choices they make when they step out that door are about being able to be active anyway, without them even thinking about the fact that they're active. So in many cases, I mean, we know, and particularly in the kind of areas that you're talking about, Emma, where you've got the GP deep end practices, only half of those households will have access to a car. So to go anywhere is a struggle. The more that we build things like schools on the very edge of town, because it's cheaper, it's a better site, you can get a better building, much more facilities. It's all done with the right intentions, but actually what it's doing is it's exacerbating life for those people living in those areas. They now have to go further to get their primary school child to school. That may involve having to consider a car that they can't afford, or it involves a bus journey that they can't afford, or it just takes the time to get their child there. That means, can they fit in the part-time job they were doing? Can they fit in caring for an elderly relative, or something has to give? So we're having those negative impacts on their lives. And we've made a change in the environment with the very best of intentions. But we've changed what happens when that person steps out their front door in the morning and how much they can take part in life. So that would be the biggest examples of what we found is, and that is why taking that place-based approach when you're making a decision on something like moving a school is so important, that you're considering the full impact that it's having, not just that general impact on it, obviously a far better building, but there are unintended consequences that taking the approach that we've taken with the Shaping Places for Wellbeing programme will enable you to identify. You may still go ahead and make that decision to do that, but you could take some mitigation actions around it as well.
So that puts me in mind of the 20-minute neighbourhood discussions about having everything within your life within a certain radius of where you live.
Your local life, yeah.
Yeah, your local life. Absolutely. Thank you. Now, both of you have touched there on communications and obviously motivations for people as well. And something that we've seen whilst we did some mapping with our coalition of organisations, health organisations at Movement for Health, around barriers for people living with chronic conditions to move more, was around that motivation due to a lack of narrative that was supporting them to move more, so and not feeling that their movement counted. So something that we are trying to do is change the narrative or influence the narrative around moving more. And there are many excellent exercise referral pathways, excellent things for many people to be involved with. That will only work if, as you said, Irene, if you want to do that thing. So I'm just wondering if either of you think of any examples within your work sphere around that communications piece and how what different methods work or have worked when thinking of either national populations or local level communications with something like Scotland's Healthiest Town, and the narrative and the wording and how inclusive can we make it without making these things, as you say, widening the gap, the inequality gap. Is there any examples from either of you in the thinking processes that go on with your work? Callum, should I come to you first?
I was hoping you'd choose Irene for this. Give me a bit of time. No, I think you touched on our choice of Scotland's Healthiest Town, or aspiring to be Scotland's Healthiest Town. Look, I'm not a communications expert. I think our hope there was to tap into kind of an innate sense of pride in and belonging, but also possibly what we dreamed of at the time was an element of competitiveness. You know, it would be great if Pitlochry or Dunblane or I don't know another town said, no, we're gonna race you to the top and inspire a race to the top. So yeah, look, I think I think it's important. I think that on the flip side of that, I think, you know, we have to be very mindful of the language we use, don't we? And you know, we've moved towards movement and physical activity and away from things like exercise. Another thing I'm mindful of is spend my life. If I when I'm not clinical, I'm academic, doing research into things like physical activity promotion in primary care and exercise referral schemes. And I am conscious that although the evidence shows that they're great and they're cost effective and effective, I think there's also a risk in so doing that we medicalize things, and we possibly medicalize movement, which if we're prescribing it, doesn't mean that it's for people that are not well, and therefore people that are well don't need to do it. So I think, just kind of playing devil's advocate slightly, that there's challenges in how we do communicate these things, as you alluded to, and maybe we need someone brighter than I to address or answer that question, Emma. Maybe I'll hand you over to Irene. Maybe Irene's got the answer.
Any solutions for us?
Something we consistently found whilst working on the Shaping Places for Wellbeing programme was the importance of communication. While you think you've communicated even what it is that you're in and looking to achieve, you haven't. You have to keep repeating it and repeating it and repeating it to get it across. Now, we were not in the business of being out working directly frontline with individuals. We were working with decision makers, councils, NHS health boards. But again, we found that people are busy, very busy. And to keep that message across about prevention, we are all very, very busy helping people to pull them out the river when they're struggling. And to keep that message about, can we also bear in mind that if we take a place-based approach to our decisions about those aspects, we can also be thinking more preventatively. We can be thinking more upstream at the same time. That's been our key message, but we certainly have found that it is about repeating that message many, many, many times. I mean, they do say you've got to hear something 7 times before it sinks into our minds. And if you're in a meeting, the same comes to, the data and what I was saying about understanding what's happening to the people in your area. Anybody like me who sees a set of data that an analyst has produced just glazes over and is overwhelmed by it. And I don't know, I kind of go, but so what? What can I do? Yeah, and that's comms that we need to be doing. And we took a lot of the profiles, put them into infographics, pulled out the top approximately 4 population groups really being impacted by inequality, because our minds only have so much comms that we can take in and take to the next meeting and to the document that we're producing in a month's time. So we really did kind of take what can be overwhelming, what I can find overwhelming, and pull it down into concise documents that then decision makers could keep in their minds and have there to refer to when they're doing funding applications, committee reports, whatever it is that people are, the process that they're needing to go through in order to make those decisions. So for us, it was more around that kind of comms and making it as quick and simple as we possibly could, but with some real kind of research in there that then could be used to help, because these are the facts and the research is the research. So it's not an opinion piece that you're doing. It's here it is, and you can really use all of this. And all the data we looked at was publicly available data sitting there for anyone to use, but so difficult if you're like me, not able to read a table and pull out the key messages from it.
Sure. So the evidence and data are incredibly important, but also the translation of that. What does that mean? And as you say, so what? What does this actually mean in the reality of the space? We've Paths for All have got some excellent programs of work that I've been privileged enough to be involved with over the years. This puts me in mind of a specific project in Prestwick, which was led by Dementia Friendly Prestwick around the promenade. I'm just talking about a physical place at the moment. The promenade along the seafront, pretty rough in certain months of the year, but there was a walking group, and Callum, I know through the Healthiest Town work, there's a walking group, that there's health walks and things that people can join. And Dementia Friendly Prestwick had this walking group that was using the promenade, but as they were using it, they noticed quite a lot of small improvements and changes that could potentially make a big world of difference for the people living with dementia across that promenade space that were using it for their weekly or bi-weekly walk. And one of which was there was a turn in the road and there wasn't a crossing that was safe area to cross. So there was a lovely piece of work done with the local planners, with the roads and transport, with the local council, with the people living with dementia, to create a safe crossing that gave enough time for people to cross who are more minor movers, as I like to describe, maybe slightly slower of pace. They didn't feel rushed or alarmed. And it has made a really big difference. And that, as well as improving surfaces and brightly coloured benches across the promenade that could be used as sort of targets for people to reach that might need visual cues. And all that took quite a lot of thought and quite a lot of energy, quite a bit of money to put that in place. But what I really like in terms of that evidence and feedback from the actual local community was that, yes, it was made and informed by people living in dementia, but the whole community has benefited. So parents with pushchairs had also said, actually, that road doesn't feel safe to cross. Young children, people out with their pets and things, and it's just improved the whole area and made it accessible for all. Though, looking at the needs of quite a specific group of people, it has improved things for everyone. So I think those types of messages are really powerful as well. We also see the Ian Finlay Path Fund at Paths for All that's working with communities to support improvements to infrastructure at a local level to make places safe, welcoming, inviting to walk, as we know that walking is the most accessible form of any kind of movement for most people. Obviously, we want to see as much as that as possible. So are those kinds of projects the ones, Irene, you're talking about that can be involved in these place-based approaches with the local council through those third sector advocates such as Paths for All and others? That's the sort of examples you're seeing across the 7 sites?
Yeah, I mean, what you've just described there is really a place-based approach, because you looked at what was happening for people factually. You looked at, you listened to what was the experience of the community then as well. You looked at improving, so that actually I could list that through of quite a few of the place and wellbeing outcomes about promoting active travel, about creating a space and streets that people want to use and stop and talk in and so on. So you were looking at the features outcomes you wanted for that place, and then they were brought into decision making by working with the council in the area as well. And we can do those kinds of changes without all 3 elements, but we're missing a trick when we do it, and we're not taking a place-based approach. So the council could have come in and said, we'll put in a new crossing, there we go, that's it. But they haven't heard about the length of time that crossing needs to last for, or about having a little bit more of a destination. So without listening to what the community are saying and to a specific population group in the community that are in need of further assistance, then that's being able to take that place-based approach. And I think in many cases, if we design for everybody in a manner with dementia, we're designing well. I've also heard we design for, there's a very good example, a lovely lady called Catherine Trebeck, who talks about the way we judge the success of a country shouldn't be by its GDP, i.e. how much money we spend on rubbish. It should be by how many 12-year-old girls are cycling to school, because that captures gender, that captures safety. And if we can achieve that and see increases in that, we are creating an environment that benefits everybody. So in a way, your Prestwick example is exactly the same. If we can creating an environment that's suiting our ageing population, and particularly the ageing population with dementia, we're actually meeting and creating an environment that helps everybody, enables everyone in that area to thrive.
Excellent. Callum, in terms of...
there you
go. No, coming right in there. Thank you.
Yeah, sorry. Very briefly, I was going to say the Prestwick example is lovely. It points on the safety aspect, and a lot of the research suggests that the biggest barrier to people using to the urban green space is feeling safe, and then the biggest facilitator is a sense of ownership. And so co-production is really important, because if people are involved in the design of the space that they're going to live in, they have a sense of ownership and therefore going to protect it. And so you create a culture of almost kind of protection and use. And I think Prestwick's a great example, and yeah, I'm sure there's many others.
And there's also the fact that where we do that, we give people, and this is another place and wellbeing outcome, we give them a sense of influence and control, and that helps their physical and mental health. So it's a double whammy that we achieve, because people have that sense of belonging, and both those sense of belonging and that influence and control actually help our health and wellbeing also. So
absolutely,
we can't lose on it, really.
No, and also that social outcome in terms of that sense of community, sense of belonging, sense of place is so important. Well, I'd like to just thank you both for joining me today to discuss Scotland's active places and spaces. We'll put links in the podcast information for both programmes of work. And thank you for listening. This series covers Scotland's 8 investments, making movement more possible for those living with health conditions. So do listen to the other episodes in the series. We hope that this helps you find your movement for health.